to discuss biomechanics associated with infrapatellar fat pad. So the true role of fat pads kind of an unknown. It's thought that it might help with gliding of the femoral condyles as well as the capsule of the knee, but it's also thought that it might be more of a reservoir for regenerative cells. All we do know though is it's highly innervated and it can cause symptoms in individuals. When you do have a problem with it, it will adhere to the back of the patella and sometimes shorten that patella. So we're just going to kind of go over some normal mechanics as well as just maybe some things to look at as far as just a real sound basic examination of range of motion and how the patella is actually moving. So normal mechanics as the knee would flex. The fat pad should retract back posteriorly, and then as it comes forward, that fat pad should also move forward towards the patella. When an adhesion builds up there, sometimes that will restrict the patella from moving cranially, and also kind of change the tilt of that patella a little bit. So something to just look at rest is really just, is that patella sitting a little low? Is it patella baja? That might give you some indication as to the involvement of the fat pad, as well as when it comes up to here, it might prematurely track along the trochlear groove. In about 60 degrees of flexion, sometimes individuals will look at the superior tilt of that patella, and if there's a lack of a tilt, sometimes that indicates a little bit of an adhesion built up there. And then also just looking at overpressure and extension is a real important one, because sometimes individuals will get symptoms with that. And then just thoroughly assessing the glide of that patella going medially, laterally. Usually superior will be restricted